This is a brief video on a type of a coccyx or tailbone injury that causes the tailbone to be stuck in a side bent position. On each side of the tailbone, which is at the bottom of the sacrum, these are the two sit bones, the tailbone is found, and it's comprised of 4 bones, and quite often they will fuse together but retain some mobility where they connect with the sacrum. And a traumatic injury, such as a fall onto your sit bones, falling on one side may cause it to get stuck in a bent position, bent to one side. And when that happens, you can find that if you palpate with your fingertips on both sides, you'll notice that on one side there's a deeper sulcus, and that is if it's side bent to the right, then you will hit on this transverse process early, whereas on the other side there's a deeper, a wider sulcus. And one would think that if one has an injury and it causes that tailbone to be bent to one side, one would think that treatment would involve directly pushing it back in the direction where it belongs. And that is at times true, but other times, if the injury involves the whole pelvis, and there's a whole twisting mechanism that occurs throughout the hip joints and the sacroiliac joints involving the whole pelvis, then these large ligaments that connect the pelvic bones to the sacrum and to the coccyx as well, those become involved, and it becomes very difficult. There are large forces that are maintaining the tailbone in a side bent position, and in those examples you have to treat that twisting pattern throughout the whole pelvis. And there's a pattern that I've discovered and described and developed treatment for, and it's called lower windswept pelvis. And that's a pattern in which there are 5 different things that you need to do to create balance in the hips and the sit bones and the sacroiliac joints prior to reducing the side bent fixation of the coccyx. So I think that serves as a nice introduction into the type of tailbone injury that is named side bent fixation. And there are other types of injuries, such as a backward bent coccyx, such as delivery of a large baby, and a fall on the tailbone can cause it to flex forward, and sometimes one of these segments will separate, and that can be named a fractured coccyx, when in fact it's actually a separation of a joint, but nonetheless that's what they call it. So this concludes my discussion, and there's a couple of other YouTube videos I've posted on the subject of coccyx pain, coccyx joint dysfunction, and also on the pattern which I named lower windswept pelvis. Thank you very much.